I just want to supplement what Dr. Udvadia has said. If the family and the patient sees you doing your best for the patient, if they see that you're coming twice a day, when the patient is critical, you're coming 3 times, 4 times, 5 times a day, that you're not just poking your head through the door, saying, hi, all's well, and then walking off, but you're taking the trouble to come every time, and every time you examine the patient, particularly when things are not going well. If at that time they see that you're doing your very best, at the same time, if they can also see that the nurses are doing their very best, the resident doctors are doing their very best, and as he quite correctly pointed out, if you're explaining to the patient's family at each stage that this is what is happening, anger is unlikely.
I can't agree with you more, Suresh. I can't agree with you more. I mean, I deal with very ill people in the ICU all the time. And they sometimes see the great concern on my face. And they come and tell me, doctor, you're very concerned. You're doing your best. You follow. They themselves realize, as Sunil said, that you're doing your very best. You see the concern on my face. You see that I'm seeing the patient so many times in the day that I often come late at night to see the patient, to see if everything is all right or not. And they see that everyone, because of you as being the head, you imbue the same spirit. It's very important in all the residents and all the senior nurses as well. They see the same thing. So it's a team approach of care and concern. You can't know everything in medicine. That's not possible. And as I told you, in a sick person with so many problems at the same time, anything can go wrong at any time. Medicine is so unpredictable. All that you can do is try your very best to do as best as you can. And sometimes it's a problem. There are many times I find that I'm at sea. I don't know what's exactly wrong with it. I know that this is wrong, but what is the underlying reason for his illness? It may be very difficult for me to find. And I believe you me, most of us, I'm sure, sometimes spend very sleepless nights. Of late, for example, I've been sleeping 3 hours a night because of a problem which I have not been able to surmount. So that's not with me alone, I promise you. It's with many people, and people don't realize that. The public also don't really realize how some doctors, many doctors, in their course of duty, and in their course of looking after patients, suffer considerably, emotionally and mentally. It's easy to say, equanimity. The doctor shows a remarkable equanimity in the face towards the patient when he's examining the patient, when he's talking to the relatives. But hardly, very few of them will, and the patient may note the concern, the relatives may note the concern. But very few realize sometimes the turmoil that goes within.
Keith, I think the difficult question to ask every time is when parents ask me, I hope you will get well. Now invariably you will say, of course you will get well. Now you are trapped. You don't want to say you may not get well. But that's quite discouraging. But at the same time you can't promise that you will just get well. But then they hold you responsible for what you said. And if something went wrong, that means there must have been an error. So what I would say is that most of such children would get well. But it depends on multiple variables. And I tell them that when the teacher teaches a group of 30 students, one of them fails, another comes first. One who fails, the parents can't go and blame the teacher for having done wrong. Because it depends on how every child responds. And I won't know how this child is going to respond. But my experience is majority respond favorably. So I hope your child also would respond favorably. But we will keep a very close watch. And if things are not going well, we will certainly take an appropriate action. Which means you have not said he will do well. You have not, of course, said, oh, he may not do well. How could you say that? And I think in Indian situation, you would always end up saying, at Wadia patients, I would say, you pray, let me do my work. I am sure we will do best. So telling them that everything is not in my hands, but what is to be done best is in my hands. My outcome is really not in my hand, but I expect a good outcome most of the time.